Getting older does not automatically mean living with constant joint pain. Many elderly people are told that stiff knees, aching backs, or painful fingers are just part of aging. Ayurveda does not see it this way. According to Ayurveda, joint pain is not caused by age alone. It is caused by imbalance, especially of Vata dosha. Today, let's understand how Ayurveda manages joint pain in the elderly using diet, lifestyle, herbal medicines, and panchakarma. Hello everyone, I'm Dr. Priya Sharma, and today we will talk about joint pain. It is commonly described as Sandhigata Vata, where aggravated Vata is localized in the joints. In some cases, especially when swelling and stiffness are heavily present, it may also involve ama or toxins, leading to a condition called amavata. As explained in Charaka Samhita, old age is naturally a vata dominant stage of life, which is characterized by dryness, coldness, and degeneration. When vata increases, it dries up the natural lubrication of the joints. Also, if digestion is weak, ama or undigested metabolic waste forms and lodges in the joint spaces, causing pain, stiffness, swelling, and loss of mobility. That is why Ayurveda does not treat joint pain alone. It treats vata imbalance and digestion together. Dry, creaky pain usually indicates vata dominance, while swollen and heavy joints with heaviness in the entire body is suggestive of ama or toxins. Now let's talk about diet first. The foundation of health. In Ayurveda, joints are nourished only when digestion is healthy. To manage joint pain, the first step is correcting your diet.
Number 1, warmth is the key. Always use warm water for drinking and bathing. Cold water shocks the nerves and increases the vata stiffness. Second, the golden lubricant cow's ghee should be included in your diet. It provides the sneha or lubrication required to cushion the joints from inside. Number 3, early to bed. Sleep by 10 p.m. Vata increases during late nights, so restorative sleep is crucial for your tissue repair. Number 4, gentle movements. Practice Sukshma Vyayama, that is subtle joint rotations or restorative yoga like Tadasana. Avoid high impact jumping or running. Next is fermentation or Svedana. Apply a warm salt bag or sand poultice to the painful joints after applying any oil. This helps the oil penetrate deeper into the tissues.
Include spices like dry ginger powder, which improves digestion and reduces the stiffness, turmeric, which supports inflammation and balance, fenugreek, which pacifies the vata, and fresh ginger, which is deepana and pachana and helps remove the toxins and improves metabolism. Include trikatu in your diet. This can be had in the middle of your lunch, 2 pinch with 1 to 2 sips of water. Helps in easy digestion and preventing toxin formation. Now, what all to avoid if you have joint pain? Cold foods, drinks which are cold, raw salads, beans unless well cooked and spiced, nightshades like tomatoes, potatoes, eggplants, etc., especially if inflammation is high. Avoid curd at night, it is heavy and it will increase inflammation. Now, Ayurveda is an individualized science, so you have to observe your body and understand what suits you and what doesn't. Now, daily care for joints. External care is vital in joint pain and related issues. Oil massage is important. Do a daily oil massage of your joints. Use warm sesame oil or Mahanarayan oil. This will help pacify the vata and inflammation. Lepa or upanaha, that is external Ayurvedic applications, are very useful in joint pains. Along with oil massage, Ayurveda uses lepa and upanaha. Both are external treatments and very effective for joint pains described in classical texts like Sushruta and Ashtanga Hridaya. Now, what is a lepa? It is a herbal paste or application. When is it to be used? When the joints are dry, stiff, pain is aggravated by cold, and there is small or limited amount of swelling. How to prepare lepa and what lepa is to be used? Number one, eranda lepa. Erand or castor leaves will be used. Classically, fresh castor leaves or eranda patra are used. Now, how to prepare this? Wash fresh castor leaves. Cut them and heat them in a pan slightly. Now grind them into a paste and add warm water, small amount of warm water and sesame oil and dry ginger powder if there is heavy stiffness in the joints. Now heat this and make a lepa or paste and apply it warm, never hot. How to apply it? Apply a thin, even layer over the joints wherein there is pain. Apply against the hair direction and cover it loosely with a cotton cloth. And patient should rest after that. No movement is recommended or allowed for at least 30 to 45 minutes. And after, see, you should not let it dry completely. Only keep it for 30 to 45 minutes, and after that you have to gently remove it using lukewarm water or a wet cloth soaked in warm water. Do not scrape forcefully. After the removal of the lepa, apply little warm oil on the area. You can use Mahanarayan oil and you should apply that and keep the joint warm and avoid any movements for next 1 hour. Now, what are the precautions you should take after applying the lepa? Avoid cold water. Avoid AC or fan. Avoid heavy movements. Give it rest and warmth. Now, which are the conditions wherein lepa is to be avoided? Redness, if you have redness or burning in the joints. There is acute hot swelling. There is a broken skin or infection, and if there are any skin allergies. Now, second external application which is very beneficial in joint pains is upanaha or herbal poultice therapy. Retained application used especially in chronic stiffness and pain of joints. Classical ingredients for upanaha are eranda, rasna, shunti, kulatha and sesame oil. You can Google the English words for these if you don't understand these words. How it is done. Herbal paste is prepared using these ingredients and it has to be applied warm, and after the application it has to be applied in a thick layer and then it has to be covered with a warm cloth, cotton cloth, and it has to be kept for at least 40 minutes or 45 minutes. And it has to be kept for a longer duration as compared to lepa. It is very useful in degenerative joint conditions. It should be done under guidance, preferably, especially in elderly people.
In Ayurveda, medicines for joint pains are typically divided into gugulus, tailas, and churnas or powders. Since joint pain in the elderly is a mix of wear and tear, that is vata, and inflammation, that is ama, doctors usually prescribe a combination of the following. Number one, the Gugulu series. Gugulu is purified resin that acts as a carrier, taking herbs deep into the joint tissues to remove the toxins. Example, Yogaraja Gugulu, which is gold standard for elderly joint pain. It rejuvenates the musculoskeletal system and balances the vata. Number two, Kaishora Gugulu, which is if there is redness, heat or high uric acid, it acts as a natural blood purifier and anti-inflammatory. Number three, Simhanada Gugulu, which is specially used in Amavata, that is rheumatoid arthritis-like symptoms, because it contains herbs that purge the toxins out of the joints. Number four, Lakshadi Gugulu, which is often prescribed if there is pain due to low bone density or healing of old fractures. Second is medicated oils for external application. For example, Mahanarayan Tela. Perhaps the most famous Ayurvedic oil, and it contains more than 50 herbs, which is excellent for paralyzed limbs, stiff joints and muscle fatigue. Second is Dhanvantaram Taila. It's a powerful anti-vata oil used for general body aches and nerve-related pains. Third is Kotam-Chukkadi Taila, which is very effective for reducing swelling and heaviness in the joints. Number four is Murivana Tail or Murivana oil, which is traditionally used for acute inflammation and localized pain. Next comes this Herbs or single herbs which are useful. Number one is shallaki. It is Ayurvedic ibuprofen. It prevents the breakdown of collagen and improves the blood supply to the joints. Second is ashwagandha, which gives the strength to nerves and muscles surrounding the joint. It is a natural adaptogen that helps with the stress of chronic pain. Third is nirgundi, which is known as Vata destroying herb. It is often used in steam treatments and internal use. Classical liquid preparations, that is kashayams, are also very beneficial. For example, Rasana Saptak Kashayam. It's a decoction which is used especially for lower back pain, hip pain, and sciatica. Balarishta, which is a fermented tonic and builds the strength in the nervous system. Very useful for soothing the elderly patients who feel weak in their legs. These are the medicines which are highly useful. If there is stiffness and cracking, we can use the combination of Yogaraja Gugulu and Mahanarayan oil. If there is swelling and heat, we can use Kaishora Gugulu and Kotam Chukkadi oil. If there is lower back pain, sciatic, we can use Rasna Saptak Kashayam and Sehcharadi Taila. If there is general weakness, we can use Ashwagandha with Balarishta. Now, these medicines can be quite potent. So, it is highly advised to use these under the guidance of a Ayurvedic doctor, because if you are taking any other medications like blood thinners or blood pressure medications, there can be interaction among these medications. So please never take these medicines on your own without consulting your Ayurvedic doctor.
Next important aspect which is very helpful in chronic joint pain is Panchakarma therapy. In long-standing joint pain, Ayurveda recommends Panchakarma therapies, which are not home treatments. Common Panchakarma therapies that work are Abhyanga or massage with Swedana or steam, Janu Basti and Kati Basti, Basti therapy, which is described as the main treatment for Vata disorders. Panchakarma should always be done under professional supervision, especially in elderly patients. Ayurvedic joint care is not about quick relief, it is about comfort, it is about mobility, and it's about improving the quality of life. By correcting the diet, supporting digestion, using oil massage and upanaha or poultice, and appropriate internal medicine and therapies, joint pain can be managed very well and safely in Ayurveda. Start small, stay consistent, and know the limits of your body. If this video helped you, subscribe for more Ayurvedic guidance and comment below which joint troubles you the most.